What is fever? A person has a fever when the body temperature is above 38 degrees Celsius. For babies younger than 6 months old, you can get the temperature reading by using an armpit thermometer. For children above 6 months old, you can take an ear temperature. Fever is the body's way to fight infection. The most common causes of fever in children are infections. Viruses cause 10 times more infections than bacteria. How high a fever is does not indicate the severity of illness. Fever caused by a viral infection may persist for 5 to 7 days. And remember, antibiotics don't treat viral infections. The best treatment for most minor viral illnesses is often rest and plenty of fluids. There are some misconceptions about fever. Number 1. Fever is high, the cause is serious. Again, the temperature itself does not indicate the severity of the illness. How your child looks is more important. Number 2. A small percentage of children aged between 6 months and 6 years old may have seizures with high fever. However, high fever itself or febrile seizures usually do not lead to brain damage. Fevers sometimes can cause discomfort in children. You can give medicines such as paracetamol or ibuprofen. Encourage your child to drink plenty of fluids and rest. Your child should look well when the body temperature comes down. It is common to have cold hands and feet while having high fever. In the case of a fever that is causing discomfort, you can use medicines such as paracetamol or ibuprofen. Paracetamol is the first line of medication, used 4 hourly when the temperature is above 38.5 degrees Celsius, 6 hourly when the temperature is below 38.5 degrees Celsius. Paracetamol suppositories can be given every 6 hours. To use ibuprofen when fever is persistently above 38.5 degrees Celsius, 1 to 2 hours after paracetamol. You can give 6 hourly. Diclofenac suppositories, which is the same class of medication as ibuprofen, you can give 12 hourly. Do not use ibuprofen in infants less than 6 months old. Do not use diclofenac suppositories in infants less than 1 year old. Do not use ibuprofen and diclofenac at the same time as they belong to the same class of medications. Give the medications at the proper intervals and dosages. Let your child rest, hydrate your child, provide comfortable clothes and environment. Consult with GP if your child is having fever but otherwise well. Things to watch out for. Number 1. Please bring your child to a doctor immediately if your child is drowsy, feeding poorly, or persistently vomiting or lethargic. Number 2. Having prolonged fever of more than 7 days. Number 3. Body temperature is above 41 degrees Celsius. Number 4. If your child is less than 3 months old and having fever. Number 5. When there's reduced urine output to suggest inadequate hydration. Rash after fever is common. It is usually marked by several days of high fever, followed by a rash just as the fever breaks. It is known as exanthema subitum or roseola. It may look widespread, but your child should otherwise be well. It can last for a few days.